Hey everybody, my name is Tom Jones Pharmacist and you are on Tom Jones Pharmacist Live. Alright, why do we have such high prescription drug prices? Does anybody know? You know, I'm a compounding pharmacist. I'm a registered pharmacist. I actually am working a little bit this afternoon and I'm working Friday. I don't understand all of the things that's going on with the drug prices, but I've got a good idea. Back in the early days, and I'm talking back in the 60s, 70s, 80s of last decade, drug prices were okay. They weren't extremely high, but they were under control. They were under control as far as being reasonably priced. But nowadays, they are not. I mean, drug prices have doubled in price in the last decade. Let's repeat that again. Prescription drug prices have doubled in price in the last 10 years. That's astounding. Where are all the new drugs at? We have a great health care drug system, except the pricing system is totally out of control. But let's stop and think about what's happened in the last several, a couple of decades probably. Let's think about how many pharmaceutical companies are there now compared to how many there were back in the 60s, 70s, 80s, 90s, 2000, 2010. You can count almost on your two hands the number of pharmaceutical companies, the major ones, for example, because they've all consolidated. There's only just a few pharmaceutical companies out there. In fact, I was just talking to someone from Eli Lilly last week, and that's one of the few pharmaceutical companies that has not been bought out or consolidated into one gigantic global company. So maybe that's one of the reasons why the drug prices of the new products are astronomical. For somebody who has insurance and who hasn't noticed the price of pharmaceuticals, because you have insurance and your drugs are paid for by your insurance company, let me just make you aware of what's happened. The pharmaceutical prices of the new drugs, and there's not a whole lot of them, are in the stratosphere. And it's not a $5 or $10 prescription. We're talking about, in a lot of cases, $5,000 to $10,000 to $15,000 a month. So these are the biologic drugs that are on the market. And all right, let's just talk about what has happened. If you're unfortunate enough to be in that minority of people who have to have one of those stratosphere type drugs and you have insurance, don't expect your insurance company to cover it. Some do, some don't. So it might have to come out of your pocket. So you've got a subset of people who have insurance, and the insurance prices haven't caught up with the new drug prices, because we're talking about a whole different class of drugs, biologic drugs for the most part. And let's go over some of the aspects of why drug prices are rising and why patients really don't understand why. Number one, there's no price controls in the United States, unlike in many countries where government agencies negotiate prices for every single solitary drug. There's no price controls. So the American drug makers, you know how they price their drugs? They price the drugs themselves. They set the wholesale drug prices based on what competing name brand drug costs and whether their drug is better or not. And that's kind of the way it works. This is the way it's always worked, because in America we don't have price controls. Now, we have free enterprise system. I like the free enterprise system, but I'm not sure it's working in this aspect, because if you've got a new drug that's covering your illness and you're sick, how the heck are you going to pay for that medication if it's $10,000 to $15,000 a month? And that's what it is for these new drugs. It's not cheap. It's not, and if your insurance doesn't cover it, and a lot of insurance companies are not covering it. Number two, so that's problem number one. That's problem number one. All the new drugs are not priced according to how it used to be. Not even $1 a tablet. It's priced lots of money, and I consider $5,000 to $10,000 a month to be lots of money. Number two, lengthy patents. Now, patents on a drug last longer here than actually in most other countries. So therefore, we want the drug manufacturers to make money. Yes, we want them to come up with the research and with the new drug that's saving people's lives. The patents, though, will last a longer period of time in the United States than it does in most other countries. And the patents are actually filed while the drug's still in testing. And the clock's running while that patent goes before all the tests. So typically, the new drugs wind up having a patent that will last longer, and it's usually about a dozen years. That's typically how it is. And drug manufacturers, here's the way it's always worked. Now, I go way back yonder, and yes, I go way back there when we didn't have all this concern about the drug prices because they weren't that expensive. But typically, 4 times a year, you can almost count it on your finger. You can almost know when the prices are going up. That's how drug companies have always priced their pharmaceuticals. They have priced their drug, increased the price. They don't go down, they go up. And this is on name brand pharmaceuticals. They go up about 4 times a year. And they generally raise their price about 5%. And this can vary a little bit. It adds up and becomes bigger. So the drug price becomes bigger over the expiration of that patent. And therefore, since there's a patent usually of about 12 years on a pharmaceutical, there's not a whole heck of a lot of competition for the drug companies. And it certainly doesn't hold the drug prices down. Many older generic drugs are priced too low to be profitable. So a lot of the drug companies will stop making the older drugs. So we wind up, and this is part of the problem too, we wind up with just 1 or 2 companies making a pharmaceutical. So therefore, I'm going to grab a sip of water. That pharmaceutical will actually go up in price if there's only one or two companies making that drug. And we've seen that in the last couple of years. We've had outcries of major issues as far as raising of prices by the fact that someone bought a pharmaceutical that was down to one manufacturer, and they immediately after they purchased it, they raised the price. There's nothing illegal about that. It's the free enterprise system. But when you only have one manufacturer and one drug, you have the ability to price it how you want to. So if there's only one or two competitors now, when there's a lot of competitors like there used to be, then we saw prices go down. So you don't have those older, very inexpensive generics in a lot of cases. And there's a short supply of the raw chemical. And that makes it very difficult for one manufacturer to go into the market and get a market share and then be able to lower the price. So if a drug manufacturer or a drug maker or if a new company wants to purchase that drug and take it to the market and build their sales from there, that's been something that's happened over the years. Number 4 of the problems, there's small markets actually. There's some drugs that are newer. They have rare conditions, and it could be cancer type pharmaceuticals. It involves a particular genetic mutation, and actually there's only thousands or hundreds of patients. So the drug company, when they come up with the new pharmaceutical that they've just spent billions for, to recoup that research and development cost, the drug makers make and set higher prices for these pharmaceuticals. And although in a lot of cases, they will offer patient financial assistance. We have to mention that. Number 5, development and production cost. And actually, this is important too, because if you have a pharmaceutical and you've just had a lot of research that was put into it, it's super astronomically expensive, and it takes over a decade and sometimes even longer than that, and well into the billion-dollar range for that new drug to get approved by the FDA. And the development cost of drugs that don't get approved, that go down the tubes, has to be added in somewhere, because the drug companies don't want to have a loss. I don't blame them for that. And most of the new drugs, though, are not even what we call pharmaceuticals. They are biologics. They're produced by the living cells under precise conditions, which the cost of making these is so much more. So much more. It's not the same as it used to be. And number 6. This is a big concern of a lot of people, and it should be. There's far fewer new generics on the market, and there was a lot of generic that went out between the first part of this decade, 2010 to about 3 years ago, and that's brought a lot of generic versions to the marketplace. So but the number of popular drugs going off patent now and in the foreseeable future has gone down. So therefore, the total spending on pharmaceutical drugs has actually gone up. So it's not uncommon for a drug now, if it's a biologic and it's for some of the exotic type cancers or MS or some of the other exotic type conditions that have fewer people who are sick from that type of illness, it's not uncommon for that monthly charge for the pharmaceutical to be in the $10,000 a month range. That's expensive. That's expensive. So there is a crisis going on in America today. This crisis is really a real crisis. And we're talking about drug costs. We're talking about drug costs being about 10% of our total health bill. And there's a lot more issues that relate with our processing through our pharmaceuticals. How do drugs get marketed to the doctors? How do drugs get sent from the manufacturer of the drug company to the final bottle or container that goes out of your pharmacy? And as a pharmacist, there's another whole issue right there, because the process from beginning to end goes through a layer, and all of those layers have profit built into them. The drugstore owner, the pharmacist, doesn't make much money in the transition of pharmaceuticals in the overall aspect of it. Pharmaceutical profit is low for the pharmacist. And it's because of that layer, that this extra layers that go from the manufacturer all the way to the drugstore. And now there's so many different aspects of it. The pharmacist doesn't even see some of the drugs that are actually on the market. That's a whole nother can of worms. But the bottom line is, in the last 10 years, about doubling the price of the pharmaceuticals that's going out of the pharmacy. Well, this has been part of the issue. There's going to be a continuation of this discussion. I think it has a lot of merit. I think most people don't understand it. And unless you live inside that process, you really don't understand all the issues. My name is Tom Jones, Pharmacist, and you have been on Tom Jones Pharmacist Live. This has been an interesting discussion about why drug prices are so high today. And we'll have more to come. Thank you for being here. You heard it first.